My name is Rose. I'm from Montana, and I've been a seasonal worker there for about 3 years now. I always had some kind of, physical difference that I noticed that I didn't think was, problematic. But when I started going through puberty around age 11 to 12, I guess, I started noticing like clothing that my friends would wear didn't really fit correctly on me, and my chest area was not really developing the same as a lot of my friends, and I noticed some physical appearance differences, but probably wasn't until I was 13 or 14 I started having chest pain and difficulty catching my breath with exercise. I would feel a lot of pressure and pain that started radiating to my back as well as I got older. And when I was in, I think, sophomore year of high school, I saw my primary care doctor at the military clinic, and he told me, I don't want to do an examination on you, but if you do have this condition, it's just cosmetic, and when you're 18, you'll qualify for breast implants. So, you can do something about the cosmetic appearance of your condition, but you really don't need to worry about, it affecting your physical ability. And, any chest pain or shortness of breath that you're experiencing is just a result of, you just need to work a little bit harder, and that's normal to happen during exercise. And, as you keep working, your heart will catch up. And it was just really frustrating and felt very dismissive. And I just decided, like, I guess I'll just work harder. And when that didn't work, it was very discouraging because I was not performing at the rate of my peers that were doing the same practices and doing the same workouts. I went to college in Nashville, and around sophomore year, I decided, the chest pain, the shortness of breath, the back pain, that kind of thing was getting worse as I was continuing to exercise, and I decided I would get a second opinion here in the States. So I saw my primary care doctor, and she said, we actually have a specialist in this condition that you were told you might have. Would you like to talk to her? And I was like, yeah, of course. Dr. Smith, I remember our meeting being pretty short, where she did an examination of me, and she was like, oh yeah, this is definitely what's going on. So that was very validating to me, and she scheduled me for surgery that same day, I think, and the rest is history. So I woke up, I was very disoriented, but the first thing I remember is taking a deep breath, even with, a lot of trauma to my chest area. I could take a full deep breath for the first time since I could ever remember. I've gone on to, really push myself, and I decided to be on a trail crew for a couple years in Montana in 2023 and 2024, and that involves a lot of hiking and carrying heavy loads and working long hours outdoors for days at a time. So I knew that I would be pushing myself physically, and I don't think I could have done it to the extent that I did without having this procedure. And then I decided to take that challenge further and become a wildland firefighter, which requires a arduous level of physical ability that I was able to pass all the tests and keep up with the rest of my crew. So I think I definitely couldn't have done any of the things that I've done in that capacity without having had the surgery. So I'm very grateful for that opportunity.